Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Parkinson's disease and COVID-19 risks. Parkinson's disease, PD, may lead to an increased risk of developing severe illness and a more complicated recovery from a COVID-19 infection. Generally, respiratory infections such as pneumonia can be more common in people diagnosed with Parkinson's disease. They are not, however, necessarily at an increased risk of COVID-19 infection occurring. In addition, those with PD who are unvaccinated have a risk of complications and death if they need to be hospitalized. /r/n/r/n Ongoing COVID-19 research does suggest that motor function difficulties common to PD may get worse with infection, and some people do experience changes in sleep, mood, or cognition. There also are reports that suggest the impact of COVID-19 can lead to a PD diagnosis, but the reasons are poorly understood. More research is needed due to mixed results. /r/n/r/nStockphoto, Getty Imagesrnrn Parkinsons disease doesn't always mean you have a higher risk of severe COVID-19 infection, but it is an underlying health issue. That, coupled with age over 50 years, can be a risk factor. /r/n/r/n There may be an increased risk of developing more severe disease from a COVID-19 infection, particularly respiratory complications, especially for those in later stages of Parkinson's disease. /r/n/r/n Hospitalization rates for those who get COVID-19 may be higher, and those with Parkinson's disease may also have a higher instance of death from COVID-19 than the general population. /r/n/r/n Parkinson's disease itself does not appear to increase the risk of COVID-19 infection. However, it can make it harder for you to recover and increases the likelihood of complications during recovery. /r/n/r/n Symptoms of PD may become worse due to COVID-19 infection, in particular motor-related function like tremors and rigidity. There's also some evidence that new motor symptoms can occur after a bout with COVID-19 infection. Other symptoms that may worsen can include /r/n/r/n Some experts note that in many cases, new or changing PD symptoms will resolve once the COVID infection is over, as is the case with other illnesses encountered by people diagnosed with PD. /r/n/r/n However, long COVID-19 symptoms, defined as lasting more than 12 weeks, may continue well after the initial infection has resolved, and there's some evidence to suggest long COVID may affect people living with PD. The symptoms also can appear to be similar to PD. /r/n/r/n COVID-19 infection has been associated with long-term effects on the following body systems. /r/n/r/n One large study found that people with a neurodegenerative condition like PD, stroke, or Alzheimer's disease were about 40% more likely to experience fatigue, brain fog, and other long COVID symptoms when compared with peers who did not have a COVID-19 infection. There is still no clear guideline on long COVID treatment. /r/n/r/n Some small studies suggest that a reciprocal relationship between COVID-19 and Parkinson's also exists, in that COVID infection can lead to PD diagnosis rather than just having effects on existing PD. /r/n/r/n Other studies don't find evidence that COVID can cause PD. For example, a very specific marker linked to PD diagnosis is the presence of alpha-synuclein accumulating in the cerebral spinal fluid, CSF. A 2022 study did not find consistent evidence that COVID-19 affects this marker, though research continues into the connections between COVID-19 and PD. /r/n/r/n It's possible that new findings will emerge with longer study timelines. /r/n/r/n People diagnosed with COVID-19 have 3 medication options approved by the Food and Drug Administration for use when there's a risk of more serious illness with a mild to moderate infection. /r/n/r/n The antiviral Paxlovid, nirmatrelvir and ritonavir, is a common choice, along with /r/n/r/n. However, there are concerns about drug interactions between COVID-19 treatment and the PD drugs you may take. Paxlovid is used with Sinomet, carbidopa/levodopa, but some studies suggest that dopamine agonist drugs may lead to worse outcomes with COVID infection. /r/n/r/n. Further, there are many other drugs used to treat COVID-19 or PD. The results of a study involving more than 6,000 people found that clorazepine, used to manage some PD symptoms, may increase the risk of COVID-19 infection. /r/n/r/n. Talk with your healthcare provider about drug interactions before starting a new treatment. You also can check for a drug interaction using this online tool for COVID-19 treatment drugs from the University of Liverpool and partner agencies. /r/n/r/n. Existing drugs used to treat PD may offer new benefits in treating COVID-19. Amantadine, approved by the FDA for both PD treatment and as an antiviral for influenza A, has shown promise as a treatment for COVID-19. More research is needed to understand these effects. It's also important to remember that drugs like amantadine may interact with some COVID-19 vaccines, though the vaccines are generally safe and encouraged for those living with PD./r/n/r/n. At the beginning of the COVID-19 pandemic, many people with PD postponed surgical procedures such as deep brain stimulation used for treatment. They also limited their office visits, group exercise classes, and many social connections important for people living with Parkinson's disease. /r/n/r/n. With the development of vaccines and changes in how COVID-19 has evolved, there are typically no restrictions for people living with PD. Precautions such as wearing a mask may be prudent, and you can talk with your healthcare provider about testing, vaccination, and other preventive measures. /r/n/r/n. Telehealth opportunities have changed how people diagnosed with PD encounter their healthcare providers, or how they engage in programs like physical therapy. If you feel cautious about in-person meetings, check on some of the distanced options. /r/n/r/n. Preventing the spread of COVID-19 remains important. The following recommendations help to prevent the spread of the virus. /r/n/r/n. Be sure to get an updated vaccine when it is available, as long as it's approved by your healthcare provider. Keep in mind that Parkinson's disease increases your risk for severe illness with COVID-19. /r/n/r/n. There is still a lot that is not known about exactly how COVID-19 affects people with Parkinson's. Some studies have shown that people with Parkinson's disease may have a higher risk of complications if infected with COVID-19, or that they may be more likely to experience long COVID. /r/n/r/n. It remains unclear how a COVID-19 infection might increase the risk of a PD diagnosis in the future. Talk with your healthcare provider about issues like your COVID-19 risk, the importance of vaccines, and any potential drug interactions between existing PD medication and COVID-19 treatment. /r/n/r/n. The information in this article is current as of the date listed. As new research becomes available, we'll update this article. For the latest on COVID-19, visit our coronavirus news page. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.